Hey, Dr. Lindsey and Wendy here. We're going to talk to you about women's brow lifts.
Yes.
And for years, I did these at the surgery center with general anesthesia. And there's a couple ways of brow lifting. One's that cut ear to ear and actually raises your hairline. And then sometimes, in fact, we saw one just last week on a lady that had gotten one done recently by a guy that did a cut down here on her forehead and these terrible scars. And the way that we do them, where you make a little cut right along the hairline. And we'll take you through a case of this. And the idea is that you have somebody, as they age, everything sags. Yeah, I'm sagging, you're sagging. And so when a woman is in her youth, this eyebrow sits just above the eye socket. And then as you get older, it hangs down. And then you compensate for that by wrinkling up your forehead. And your eyelids get loose too, and so things just kind of
Gravity brings really down.
And so this is our patient beforehand. And you can see her brows are kind of low. She looks kind of tired through the face. And so what we did, and we'd done this on her in, I think, 2009. It is 2019, so this lasted about 10 years for her.
Yeah, that's one question the female says, how long does it last?
Yep. And so we just took her back to the procedure room and gave her a little Valium and then numbed up the forehead. And that took about, 2 minutes to numb her up, and that stings a little bit. And then waited 10 minutes for everything to really get numb, and we just made a little cut behind the hairline. But I angled the cut so that, here's some hair, so we cut so that the hair roots grow back in front of the scar as she heals. And we pull the forehead down and take out some of this frowning muscle, and then free up the forehead from the bone and pull up. And you pull up more than you think. You don't have to look real surprised, but at least for the first week or so, you do look a little bit surprised. And then they cut off some skin and then sew it back up. And what's it take, about 45 minutes? Something like that?
Yeah.
And you wrapped up pretty tight for the first night. And so here she is early on. And then at a week, the stitches come out. Really 5 or 6 days, the stitches come out. And then she's brown like me and roughly the same age as me. And this is her scar at about a month. And then this is her scar several months out. And so these little things do well.
They do, yes. And it definitely refreshes your look because you're pulling, you're basically bringing your when you were younger.
Yeah, pulling everything back up.
Pulling them out, and it definitely gives you look awake. You look refreshed.
Yes.
You really look like that. Yeah.
And it doesn't hurt a whole lot. The numbing up hurts, and it's a little bit sore the first night, but we've done a whole bunch of these things, and nobody really says it hurts much. It hurts less than a facelift.
Yeah, I think the weirdest thing for women it says is just it feels numb here.
And mainly behind the cut, it feels numb for a couple months.
That's it. So they said that it feels numb here. This is where it starts to grow back, and then here just a little bit.
Yeah.
When they're combing their hair, but overall, there's really not much downtime. It's basically like 6 days.
Yeah.
So they like that.
Yeah. So we've done a whole bunch of these with people asleep, and we're doing more of them now with people just sedated.
Yeah.
And if it's something we can help you with, please give us a call. Thanks.